that have been well researched. And you are now going around the province and you're listening to comments from various communities regarding changes in the governance of health care. There's quite a large response here in the Miramichi. And this is not something that people do just to fill their day. There is a genuine anxiety in the Miramichi. And this is not something that has come without justification. I'm going to speak today on something that cannot be construed as rumor. I'm going to discuss with all of you the facts that have caused the people that are here today and the people in this community to be so concerned. I'm going to be saying some things that will not be very pleasing to the Liberals. They will not be very pleasing to the Conservatives. They will not be very pleasing to the NDP. They will not be very pleasing to the head of the Nurses Union. They will not be very pleasing to everybody who has been an obstacle at one time or another to the proper, justified, fair treatment that the Miramichi deserves. I think it's important that we have no partisan differences on this issue, on the Miramichi. This is not a time, MLAs, to play little partisan games about good guys and bad guys. The people in the Miramichi are fed up with this, and I want to go through a little discourse and explain to you how all parties have come short of doing what's right by the Miramichi. I know, I was there. To start, Madam Minister, members of the committee, I'm just going to keep dealing with health, but we had a very traumatic situation in the early 60s when we lost our university. We were told by the government in the Byrne report that this was all in the interest of centralizing. So St. Thomas was trotted off to Fredericton, and no sooner did they shut the lights off at St. Thomas and the Miramichi than they turned aside for UNB St. John. And now it's a full-fledged university. No sooner did they turn aside for UNB St. John than they began to exaggerate and complement and expand the campus of the University of Moncton in Shepparton and in Ennis. Those are really, really progressive moves. But we got shafted. We got shafted in the Miramichi. Shortly afterwards, in the early 1970s, there was a move to shut down our only Institute of Learning, and that's our schools of nursing. We had two, one in each hospital here. I co-chaired a campaign that developed a petition with 10,000 signatures from Riviere to Portage to Doketown, from Escuminac to Rogersville, to keep our schools of nursing. The schools of nursing closed, mainly at the encouragement of the New Brunswick Association of Nurses, who said they should be closed. But you can get a nurse's education now in Bathurst, and you get it in Moncton, you get it in Fredericton, but you can't get it in Miramichi anymore. You're going to see a theme here. There's people in Miramichi are beginning to feel that we just don't fit into southern New Brunswick, and we don't fit into northern New Brunswick. We're sort of like orphans that sometimes we feel the rest of the province would prefer if we just went away. Maybe we should amalgamate with the Magdalen Islands. I don't know. Get more attention. Then came the issue of a regional hospital. And the government of Mr. Hatfield, after building a regional hospital in Inniston, and Campbellton, and Crackley, and Bathurst, and Moncton, and St. John, and Fredericton, was convinced that it was time for a regional hospital on the Miramichi. Land was purchased, and the talk was for a regional hospital. 1987, an election in which I participated, the leader of the opposition, my leader, indicated that he was not convinced that there should be a regional hospital in the Miramichi. And you may take this confused, but I'm talking about how there are pressures outside of the Miramichi. The McKellar-Levesque report, and Mr. probably familiar with it, recommended that there be no regional status for Miramichi. Leader of the Liberal Party at the time, knowing he was going to be Premier, knew that this was going to be a big expense. He told the Miramichi leader in September of 1987 that the existing two hospitals should be improved and not replaced by a regional hospital. Not replaced. At a nomination convention before 3,000 Miramichiers, the promise was made that immediately after the election, the government would put money into fixing up both hospitals. That's quote. So you see, no matter which party is in, there are always pressures from outside the region to put the shaft to the Miramichi. Following the election, the four MLAs sat down with the Premier. I'm talking Reggie McDonald, Danny Gay, Morris Green, myself, and Premier McKenna, and basically stated we cannot accept a patch job on two old hospitals. We need a regional hospital. We need a regional hospital. And the decision was made to go with a regional hospital. The land was purchased in 1990. The decision was made to go with a regional hospital. Now you would think that that would be a pretty, basically well-accepted position. But when it was announced that there was going to be a regional hospital in Miramichi, the response from the opposition, which had previously supported a regional hospital in Miramichi, the response from the opposition leader, who is now a judge, stated, "I am shocked that they would make this announcement for a hospital in the Miramichi when they should be aware of other more pressing needs in the healthcare system." You see how they changed? They changed back and forth, they changed back and forth. By 1994, we had a full-blown debate. And when the issue came up for budgeting for the Miramichi Hospital, don't forget, Crackney was done, Edmondson was done, Cameron was done, Bathurst was done, Newton was done, St. John was done, Frederick was done, they're all done, except Miramichi. We got it for the tail in the caboose of the train. The response was, "Nous avons vu 35 millions de dollars et quelques 10 millions de dollars pour l'équipement alors à un seul hôpital de Nouveau-Brunswick. Êtes-vous capable de dire à la Chambre que vous ne ferez pas seulement une région, soit la Miramichi?" That was the official opposition response, which basically stated, you have $35 million for capital, $10 million for equipment, going to a single hospital, and you have the gall to get up here, Mr. Minister, and say that you're not favoring the Miramichi. This is from a party who previously, when in government, supported a regional hospital. Then it goes on. We had more against us. The president of the Nurses Union, Linda Silas Martin, president from 1990 to the year 2000, openly, aggressively, on behalf of the Nurses Union of New Brunswick, opposed the construction of a regional hospital in the Miramichi. This is not formal. It was publicized widely. She came to the Rotary Club at Newcastle to deliver the same message. And they said, "Why? Why were you against, when you were president of the Nurses Union of New Brunswick, why were you against a regional hospital for Miramichi?" She said, "Because the money could have been spent better somewhere else." You see, there's no reason why the people of the Miramichi have sort of like shell shock when we feel we're sort of all alone. Then it came time to look at the boundaries again. Right after the defeat of Mr. Terrio and his government, and there was a new government, and they said, let's have a look at the boundaries. And this whole talk was all going on then. Let's take Big St. Anne and we'll put it in with Moncton, beef up their budget. We'll take Nicolak, we'll put it in with Bathurst, beef up their budget. The people came. They came by the thousands, and there was a rally, much larger than this, to say no. And most of the people came were from Bay St. Anne, Rogersville, and they went. So we thought that was the end of it, but it wasn't the end. Then by 2004, now I'm not blaming politicians on this. This is the bureaucrats, always the bureaucrats who have their own deals. You people come and you people go, and the bureaucrats stay until they get their kiss-off pensions and away to only to resurface on some kind of a consultative basis at $500 an hour. Present company too, of course. Then, in 2004, there was the other issue. The question of downsizing the beds for the Miramichi Hospital. Whether it was a rumor or whether it was not, there was some concern. To the point that the administrator of the hospital, Mr. Wolstenholme, had raised a concern with his board, and the medical community in Miramichi was concerned. I had just been elected mayor of the city at the time. Brought to my attention the union, nurses union, and the acute union were concerned. People were concerned. And there was a rally held. Many of the people who are in this room today were at that rally. And many of the people in this room today spoke at that rally. And what really raised the tempo of that was the day that the rally was held. And it was sponsored by the city of Miramichi and the employees and so on. The administrator, Mr. Wolstenholme, was summoned to Fredericton. Just like back in the old Soviet Union days when spies were brought back to Moscow for briefing. Okay? Only you never heard of him. We never heard of him again either. The very afternoon before the public meeting, you imagine how exciting that would be. It couldn't even wait till the next day at Canada. The very day he was brought in and basically given the issue. Either you resign and get your benefits and leave nicely, or you're going to be fired. So you have to fall on your sword and go away. So he resigned. He resigned before the meeting was held that night. And when the chairman of the board, Mr. Knowles, was asked, has the administrator of the hospital been fired in Fredericton this afternoon? He said, yes, he's been fired. So that's not true. There was a petition. There are many petitions. The next issue I want to bring up here is after then the government changed. And we had, for example, a concern about oncology. So the new government that has been replaced since, the new government in their day, like 2007, announced that they were going to establish oncology clinics for Northern Brunswick. So this is good. I mean, we're in the cancer capital of Canada here in Miramichi. It's really bad, and people are traumatized by it. And anything that will help people deal with it is a positive thing. So the oncology clinics were announced by the Minister of Health today. We're going to have an oncology clinic at Hamilton Regional Hospital. Bingo, there's one, that's good. We're going to have an oncology clinic at Bathurst Regional Hospital. Bingo, that's good, 2 out of 3. Waiting, Miramichi Hospital. Oh no, the third one, Carrigat Community Hospital. It's going to be the next one, the third one. No mention of Miramichi. So then we had to get on the ball again and rant and rave and go on and on and on. Oh, it was an oversight. It's an oversight. It's in the next budget. That was an oversight.